Hello, my name is Nurse Pauline. Welcome to my channel. Today we will be going over Fundamentals of Nursing exam 1, and this is part 5. Please hit the like button, please subscribe, please share. Thank you. If your patient's glucose is less than 60, what do? You check to see if there's an order for dextrose 50% syringe, PRN. Patient on neutropenic precaution, what does that mean to you? Your patients who are on neutropenic precautions, their WBCs are low. These patients will be on reverse isolation. All staff, families that enter the room should have gowns, masks, and gloves on. No fruits are allowed in the rooms. No flowers from the outside are allowed in the rooms. Nothing to be brought from the outside into the patient's room. If the patient is leaving the room for tests, we should have a mask placed on the patient's face before the patient leaves to go out in the hallway. Hand washing for neutropenic patients are very important. What precaution would your patients be if they are on heparin? The answer is bleeding precaution. Teach patient, do not use electric razors. Teach patients to use electric razors. Electric razors, okay. Teach patients to use soft toothbrush. Teach patients not to blow their nostrils forcibly. Patients are on bleeding precautions. What diet would we order for these patients? Your patient is a diabetic. What diet will be ordered for this patient? This patient is going to have an order for a diabetic diet. Patients who have high cholesterol, the doctor will order a low cholesterol diet. Patients with high blood pressure, low sodium diet. Patients with cardiac diagnosis, these patients will be on a cardiac diet. Inpatients post-operatively, the diet for these patients are NPO, nothing by mouth. Oral care should be provided, but they will not swallow any liquids. Doctor will advance these patients from NPO to clear liquid diet. Bariatric patients will be on a bariatric clear diet after they have been advanced from an NPO diet. For bariatric patients, no straws are allowed. You're gonna be administering a TB time test. What will be your route of administration? The TB time test is given intradermally. It's an intradermal injection. For a TB time test, if your test is abnormal, what will you assess for? You assess for redness and a hard bump. After administering TB time test today, how many days should you assess the site to verify whether or not the patient is positive or negative? You will assess the patient's site 2 to 3 days after administration of a TB time test. If the patient has a red hard bump, that shows that the patient is infected. What are your interventions for sprains and strains? The word is RICE. Rest, ice, compression and elevation. This decreases swelling, this decreases pain, and this speeds healing. What are your anticoagulants? We're talking about aspirin, Plavix, heparin, warfarin, Coumadin. These patients are placed on bleeding precaution. Assess their stools for bleeding. We're going to be administering an enema for your patient. Which side will you position your patient on? You position your patient in the Sims position on the left side, knees up to the chest. Sims position, left side is the answer. Your patients are on warfarin, Coumadin. What will be your dietary teaching? You'll teach patients to avoid green leafy vegetables, avoid cabbage, spinach, lettuce. What are the indications for vitamin B12 injections? Vitamin B12 injections are administered to patients with pernicious anemia. What is the indications for patients with abnormal urine? The color of abnormal urine is cloudy, milky, mucus crystal sediments, stones. Normal urine is clear yellow, straw yellow. Abnormal urine, abnormal odor in urine. What is your abnormal odor in urine? The answer is foul smelling urine, which indicates the presence of bacteria. Example, UTI infections. I have 2 thermometers in my hand. One is red and one is blue. I'm supposed to be taking an oral temperature on my patient. Which thermometer will I use for my oral temperature? I will use the blue thermometer for my oral temperature. When you take an axillary temp, your axillary temp is 1 degree Fahrenheit lower than your oral temp. If my temp is 99, my axillary temp will be 98 degrees Fahrenheit. For your rectal temp, you will use your rectal thermometer, and that will be your red thermometer for your rectal temp. The red is the tip of the thermometer for your rectal temp is red and it's round. The tip for your oral temp is blue and it's longer than the rectal thermometer. Indications, contraindications for patients using rectal thermometers. Rectal thermometers, that's your red. You should not use rectal thermometers on patients post-operatively who have had thyroidectomy, rectal surgeries. Patients with cardiac issues you should not use a rectal thermometer for patients with cardiac issues, because this decreases the vagus nerves. This decreases the vagus nerves. If my oral temp is 99, my rectal temp will be 100. That's a core temp. Your rectal temperature is 1 degree Fahrenheit greater than your oral temp. Your axillary temp is 1 degree less than your oral temp. We're talking about our stethoscope. Do you know the difference between the diaphragm of your stethoscope from your bell of the stethoscope? The diaphragm of your stethoscope is larger, it's round, it's flat, it's larger than the bell. The diaphragm on your stethoscope is used to detect high-pitched sounds. It's round and it's larger, circular in size than the bell. The bell of the stethoscope is used for low-pitched sounds, abdominal sounds, heart murmurs. Before suctioning your patients, what will you do? You'll elevate the head of the bed 90 degrees. You'll hyperoxygenate your patient. You can turn it up to 10 liters. You will suction your patients for 10 to 15 seconds. You'll stop for 30 to 1 minute to allow your patient to rest in between suction before doing a second round of suctioning. After you're finished suctioning your patients, you turn the oxygen down to the previous rate. If it was on 2 liters, you turn it back to 2 liters as you saw it. If it was 3 liters, you turn it back down to 3 liters. Make sure your patients are comfortable, they are not in any distress before you leave the bedside. Make sure that your patient's oxygen is greater than 92%. We're talking about conduction. Do you know the definition of conduction? Conduction is transferring heat, transferring internal heat away from the body to the skin via the blood vessels. Conduction is transferring of heat from one object to another by direct contact. My temp is 99.6. I'm having a headache. My forehead is hot. What do? I'm going to take a washcloth, and I usually do ice water, cold water. And you place that washcloth across your forehead from right to left, and that will decrease your temperature. That is an example of conduction. Another example of conduction, if you are cooking and maybe you're burnt, you get burnt, then you will place ice on the side. This is an indication that is used to decrease the temperature at the side. Sometimes you can feel that heat. The ice is used to cool the hand. This is an example of conduction. You're doing an assessment on your pupils. What does PERLA means when you're doing a pupil assessment? PERLA. This means pupil equal round, reactive to light. This measures how well your pupils are working. Please hit the like button. Please subscribe. Please share my video. Thanks for watching today. I wish you good luck in your exams. Thank you. Have a good day.